Hi, so I'm going to be doing the ophthalmic administration of timolol eye drops. But after my first couple takes, I want to show you I literally have nothing on my wall because I find that I stare at it a lot and it kind of looks like I'm reading something, but I swear I'm just staring at the wall. So, so what I would do to start with is I would get into my electronic health record with my medication system, and I would check the provider's orders for the patient's medication that I'm looking to administer. I would get into the medication system and I would get the medication that I would be using, which timolol. So I would get in there, I would check the provider orders and make sure that I have my correct patient, my correct medication, that I would be giving the correct dose, the correct route, the correct time, and then when I do document that, the correct documentation. So then I would go ahead and I'd go over to the electronic health record and I would go ahead and verify all those 6 rights again against the medication to make sure that everything matched, and that would be my first 2 medication checks. And since everything checked out, I would want to look at the frequency. So the doctor ordered that they have timolol 1 drop in each eye, BID twice a day. So I would know that I need to give the medication twice a day during waking hours. If it was supposed to be every 12 hours, it would be Q12H. However, I could give the medication at 8 o'clock in the morning and 8 o'clock at night, and then that way it is spaced evenly so it has the therapeutic effect that the doctor wants it to have. So then I need to calculate the dosage. Well, according to the doctor's orders, they want 1 drop in each eye for each dose, and it is 3.4 milligrams per milliliter. However, I can't calculate the exact correct dose because I would need to know how many drops per mil. If there's 5 mils in the bottle, I would need to know how many drops are in the bottle altogether, and then divide that by 5. So I knew how many drops per mil so that I can correctly calculate how many milligrams per drop. But I don't know how many drops. But I do know that 3.4 milligrams per milliliter, and that I'm giving 1 drop in each eye. So I will go ahead and lock up my system and take my medication, and I would go to my patient's room. I got my patient here. And good morning, my name is Tiffany. I'm going to be your nurse today. I would pull the curtain for privacy. I would perform my hand hygiene, and I would verify my patient with 2 patient identifiers. I would say, can I please verify your first and last name and your date of birth? And I would compare that against their wristband. And so once they are verified, I would, I would let them know why I'm here. So as I'm going over to my charting station, I would let them know I'm here to go ahead and administer your orthopedic eye drops, timolol. Do you know what these are for? And if they did know what they were for, I would listen to make sure that they had the correct information. And if they didn't, or if they had incorrect information, I would let them know. These timolol eye drops are used for your open angle glaucoma. Because you have that built up pressure in your eye, when I administer these, it's going to reduce that pressure by reducing the aqueous fluid in the eye that's creating that interocular pressure. And so if they had any questions, I would go ahead and answer their questions regarding the medication. And then I would ask them, are there any allergies that you have, including medication allergies, seasonal allergies, allergies to food, or any sensitivities that you may have to any of those things that I need to be aware of? And Of course, I'd make sure that everything is documented in the systems, and if they did have an allergy, that they had their little red allergy band on. And so then once, they felt comfortable and they knew the reason why I'm giving them this medication and how it's used, I would go ahead and let them know that when I do administer the eye drops, you might feel a little bit of burning or stinging. That's a common side effect with this medication. After I administer the eye drops, I am going to go ahead and hold those nasolacrimal ducts on the side of your face for 30 to 60 seconds because I want this medication to absorb locally, and I don't want your tears to come out and wash the medication away. And plus, I also don't want them to absorb through the nasal passage because it can get into your blood and cause a systemic effect. And that systemic effect could cause hypotension, bradycardia, and vasoconstriction. And we don't want any of those to happen. So that's why I'm going to go ahead and hold those ducts. And so what I'm going to do first is I want to do a pre-workup. I want to check your blood pressure. I want to check your heart rate. And then I also want to listen to your breathing sounds just so I can get a baseline so that when I check afterwards, we can make sure that you're not experiencing any of those systemic adverse effects. So then I would go ahead and I would perform my assessment. And I would document that in the electronic health record, what the numbers were for their pre-workup. And then I would go ahead and I would go get a warm water basin with some of the oh my goodness, the non-drying soap and some clean washcloths. I would go ahead and I would inspect their eyes, and I would notate any crusties or whatnot that they had. And if they have just like a little bit of crusty in the corner of their eye, I would use my washcloth with non-rinse soap. I would use my washcloth with the warm water and the non-rinse soap, and I would go ahead and wash from the inner canthus to the outer canthus on both eyes. If they had a lot of crusties, I would let that washcloth rest on their eye for a little bit until those crusties can kind of soften up so that I can gently wash from the inner canthus to the outer canthus, every wipe using a different section of my washcloth, which is why I'd have a couple washcloths just in case they had a lot of crusties. And then I definitely wouldn't want to scrub. I don't want to cause any irritation, which is why you let those crusties soak for a little bit to get them off nice and cleanly. And then I would go ahead and go dump my water, put everything aside, throw away my washcloths in the washing bin, and I would remove my gloves, throw them away properly, perform some hand hygiene, and then I would make sure I was all set up with my my gauze and my tissues that I will be needing to administer these eye drops. And I would go ahead and have my patient get in a comfortable position. So if they wanted to be in bed, they could be supine, maybe a slight elevation, nothing more than 30 degrees. Or they could sit in a chair and just have their neck a little hyper extended. It might be more comfortable to lay down. But I would get them in that correct position. And I guess because I touched the bed and stuff, I would remove those gloves, hand hygiene, new clean gloves, and I would get my medication that I have checked against the medical record for all of those 6 rights, and so that my 3 checks have been completely performed. And I would have my patient and I would use my gauze pad and place it on their cheekbone, and I would have them look up. And so while I'm pulling that conjunctival sac down and they're looking up, I would place my dominant hand on their forehead, and I would go 1/2 to 3/4 an inch, and I would drop one drop into that conjunctival sac, making sure they didn't close their eyes or blink or anything. It went actually into their eye. And then I would have a tissue and I would hold that nasolacrimal duct for 60 seconds. And I would ask them to slowly and gently blink their eye so that the medication gets distributed properly. So I would hold that for 60 seconds. I'd be watching on my watch. And then once that was done, I would throw that tissue away. I'd get a clean gauze, and I'd go ahead and do the same to the other eye. Hold their cheekbone, making sure I don't put any pressure on their eye. Opening their conjunctival, pulling down their conjunctival sac. And my dominant hand on their forehead, 1/2 to 3/4 an inch, and I would make sure that one drop went into the conjunctival sac. I would ask them to slowly close and open their eye. I would hold that nasolacrimal duct on this side for the 30 to 60 seconds. And when all that was done, I would go ahead and just ask them to keep their head reclined. I would get a clean tissue and I would go ahead and dab and wipe any medication or tears that might be on their face. And then I would go ahead and remove my gloves. I would perform hand hygiene, and I would make sure that my pre-assessment, my administration of the medication was documented. And then I would want to perform that post-assessment and again check their heart rate, their blood pressure, and listen to their lung sounds to make sure that they're not experiencing any of those systemic effects. And I would go ahead and document that they are not, if they're not, that I document the numbers in there of what they were. So we had our baseline and we had our post-assessment numbers. So we know that they're not having any kind of reaction. And then I would go ahead and I would give my patient their bedside tray. I would make sure that all of the things that they use regularly are on it. Their cell phone, their water, any tissues they might need, the remote for the TV. I would put their bed back into like that lower position. And I would make sure they're comfortable, ask if they had any more questions, and if they didn't, I would perform hand hygiene, and I can open the curtain, and then we would be all done.